Looks like our number is slowing a bit. So good afternoon and welcome to the Reopening Committee January Town Hall, where we'll be discussing an update of the current COVID-19 response and details about the upcoming winter 2021 semester for our entire Flint community. We decided today to have a town hall that includes faculty, staff, and students. So keep that in mind as you're framing your questions. During today's session, we're going to cover the following topics up on the slide. Please submit your questions via the Q&A button on your screen as they occur to you, and I'll try to field them as we move through the content. It's our intent to get to all of your questions and to provide you with some guidance as we all move through 2021. Our panelists today who are here to help answer your questions include me, Shelby Newport. I'm the Associate Provost and Dean of Undergraduate Studies and a faculty member from the Department of Theater and Dance. We're joined by Mike Hague, the Vice Chancellor of Business and Finance and the Chair of our Reopening Committee. Beth Manning, the Director of University Human Resources. Mike Lane, our Director of Environment and Health and Safety. And Julie Snyder, the Associate Vice Chancellor and Dean of Students. Now we're going to get started with Vice Chancellor Mike Hague with some opening remarks about some of our successes from our fall term.
Thanks, Shelby, and good afternoon, everybody. So as we enter the new year, I want to extend my thanks to you, our dedicated committed U of M Flint community for your flexibility, creativity, and willingness to stay home to keep one another safe. Things will continue to be challenging in this coming winter term, but on behalf of campus leadership, we are committed to supporting you and will continue to strive to keep our community safe. I have the pleasure of being able to highlight some of our successes from the fall semester. Thanks to your efforts, we have evidence to suggest that while we did report 54 on-campus positive cases during infection period, we did not have spread in our classrooms and labs. And our positivity rate remains one of the lowest among the Michigan colleges and universities. We successfully housed 103 residential students in Riverfront without major incident. We managed to persevere through a major semester with 90% of our faculty and staff working remotely. This is not an easy task, especially for those who also have to manage kids at home, and a very special thank you to our staff and faculty whose job required them to continue their work on campus. We had 2,026 points of participation in recurring virtual student programming and events, and 1,283 participation in one-time virtual student programs and events offered by the Division of Student Affairs. We were able to continue on with construction and updates to the Riverfront Banquet Center, and we hope to be open to that space soon. We are nearing the completion of the Murchie Science Building extension and other renovations in the White Building that will greatly enhance our academic programs and benefit our students greatly. We yielded approximately $165,000 in utility savings by keeping our campus density low. Our Office of Extended Learning reports that faculty created more than, ready for this, 2 million minutes of lecture media, which is a 372% increase from the media produced in the prior year, and almost 1,000 Zoom sessions were created for teaching space. Students acknowledged the great work of their faculty by awarding 255 Golden Apple Awards through the Thompson Center for Learning and Teaching. We have a lot to be proud of, and while it may seem like winter term is bringing more of the same remote work, I am sure our students, staff, and faculty will continue to show up and prove that we are among the leaders and the best. Brighter days are ahead, and it is our hope that the next town hall we will be able to begin to address transition back to campus. With your continued help and support, we will get there together. Back to you, Shelby.
Thank you, Mike. We will now dive into what to expect in this coming term. Please submit your questions via the Q&A button on your screen, and it is our intent to answer everything that is received. So start submitting, and we will insert the questions as they come into the topics that we're discussing, as well as leave time at the end for additional questions. To begin our update is Beth Manning, the Director of University Human Resources. Beth?
Thanks, Shelby and Mike, and thanks to all of you for attending today. Um, Consistent with previous messaging, and just like the fall 2020 semester, all of our employees who are able should continue to work remotely until further notice. And this is directed by their supervisor. We need to remind each other to practice compassion and empathy while balancing that work that needs to be performed and all the policies in place intended to slow down the spread of the coronavirus. For employees who must work on campus, supervisors, deans, and directors have completed work plans that are consistent with the state of Michigan's executive orders and our current U of M practice. Employees should contact their supervisor if they have any questions regarding their specific work arrangements. And supervisors, if you haven't done so already, please connect with all employees regarding the work environment and those arrangements to make sure everybody's clear and there's a smooth transition into the winter semester. Supervisors and employees should also make sure they're coordinating vacation and time to be unplugged from work, as it will be increasingly more important to try to maintain good and healthy work-life balance while working remotely. Staff and supervisors can utilize various remote working resources by going to our website, the University of Michigan-Flint HR website, and clicking on remote working resources. If an employee is not able to work remotely or on campus due to a medical condition, they need to work with Susie Bai, who is our benefits coordinator in our office. You can reach her by her email in conjunction with the work connections to determine if there is a reasonable accommodation that can be made. If an employee has COVID symptoms, has been exposed to a person who has or has a household member who has COVID tested positive or been exposed to a person who has, then they do need to report via the process that Mike Lane will discuss later on in the presentation. As we approach the spring semester, so we're talking about May at this point, we should expect a slow dial-up and a bit of a staggered approach to returning to campus. Advance notice will be provided and the return to work may look different for different areas, offices, and roles. We're getting questions as to whether any remote work will be allowed in the future. The answer is maybe. The university currently has a team working through policies which allow more flexibility for options. What would be critical is how we use these policies, is how the work on and off campus will positively impact our students. Our campus leadership will make those determinations on what is the best combination for our campus on and off work, and it will be intended to provide our students with everything they need to be successful in their academic pursuits. We ask you to stay tuned for more communications regarding work environments, and if you have any questions, please don't hesitate to call our HR office or any of the reopening committee members. Back to you, Shelby.
Thanks, Beth. And now on to academics. You're going to hear the theme for today quite a few times, this slow dial up. And we actually talked about it in the spring as well, but it's not, none of these areas are going to be a flip of the switch. We all, I think, can agree that we're not going to go right back to the way we were prior to COVID-19. So as far as academics, we have a winter term plan that is in many ways similar to fall. Our campus density will remain low, with around 75% of our courses meeting remotely, either synchronously or asynchronously. Here's some statistics about the section numbers that show you how the sections are divided up based on percentage. We will continue to offer the pass-fail grade mode, which allows students to make the choice at the end of the term to opt into a modified grading scheme that acknowledges the unprecedented circumstances we are operating in. Faculty, you may consider adding language to your course syllabus that outlines the pros and cons of electing this option, and think about having early and more regular conversations because it isn't necessarily the right choice for all circumstances. And students, take the time now to discuss the pros and cons with your academic advisor and your faculty members. We want you to make an informed decision when the end of the term arrives, and we'll soon release the dates and the timeline for electing those options. An FAQ document can be found at the link that Nick has shared in the chat. Here are a few reminders of the modified calendar that has already previously been published and discussed in past town halls. We have added 2 well-being days, one on February 24th and one on March 23rd, where academic activities will be paused and students will have a chance to rest and catch up. The Thompson Library will continue to be open for use by our Flint community only. Their regular hours will begin again on the 19th, and we strongly encourage the use of their study space reservation system and curbside pickup for library items. And all of that can be accessed, including their hours, on their website. The library is a great place to use reliable internet and computers for taking tests. And we want to make sure that students have access to these resources. So utilize the library, because as we saw in fall, the density and the traffic in the library is much lower than it has been in the past. You may be interested to see some of the behind the scenes work on campus density. We have a subcommittee working on density that includes folks from the registrar, the facilities and operations, and academic affairs. Next slide, Nick. These charts provide guidance, as it were, of what the campus density looks like in specific buildings. So you may want to use these charts to decide when you want to come to campus to study or go to your office during a time that is less busy. You can see the divisions of the kinds of populations that are coming into those buildings, and then the times of days across the bottom. Now let's discuss the logistics of coming to campus. And to help us do this, please welcome Chief Ray Hall. Chief.
Yeah, thanks, Shelby, and welcome everyone. We are still operating in a remote working environment, as Beth just stated. However, should you need to come to campus for classes or for any other reason this term, here's what you can expect. We will continue to have health screening locations at each of the building gateways. DPS will be there to greet you, and behind that mask will be a smile at each of the gateways. You will need to swipe your M card and show your responsive green screen. This is the only time we want to see green on campus, by the way. You then will find an updated wayfindings within the buildings. And please, for building hours, visit the building hours website that will be updated with the winter term hours on Tuesday, January 19th. The only gateways that will be in a different location this term is the Murchie Science Building. You will now do your health screening in the new east portion of the building. Face coverings are still required in all university property. And just as a reminder, please cover both your mouth and face with your face covering. Open parking will continue for the winter semester. A parking permit is required. Please visit the DPS website for additional information. M-Card station will also be available for in-person service to all new students and employees the first week of the term at the UPAV between 11 a.m. and 3 p.m. And again, to get additional information, please visit the DPS website. So thanks again, Shelby.
Thank you, Ray. We would now like to review the on-campus testing plan and information regarding the vaccine. And to update us in those areas, we are joined by Mike Lane, the Director of Environmental Health and Safety. Mike has been working closely with our colleagues across all campuses and Michigan Medicine, as well as here locally with the Genesee County Health Department on monitoring cases and setting up our mitigation strategies. So Mike, your update.
Yeah, thank you, Shelby. And thank you everyone for joining this afternoon. Great opportunity to bring folks up to speed on some new information. One of which is our testing for the winter 2021. We had some testing events that took place during the fall. They were fairly successful and actually were really important in identifying some individuals that were asymptomatic that turned out to be positive for COVID and allowed us to respond and help those individuals and reduce the spread. So again, for this term, winter 2021, we are partnered with Michigan Medicine, their M Labs, as well as UHS, University of Health Systems, and this time with the University of Michigan-Flint School of Nursing. So thank you, Megan Kaiser and Connie Creech on that. I want to remind folks the testing that will be occurring during the winter is for asymptomatic individuals. It's for those individuals who either live on campus, are taking classes on campus, working on campus, but in some way coming to the Flint campus for learning, work, whatever business you may have. We're not asking people that don't need to come to campus to come and be tested. There's other options for you to go through and get that testing. So as far as the logistics, we have testing scheduled about twice as many testing events than we did in the winter or in the fall. But they're scheduled every other week, and it starts January 17th and 18th when the students who are living on campus will be moving in every other week all the way through April 13th. The process will be slightly different than it was, again, in hopes to help make this as easy and convenient for individuals who are choosing to come and get tested. The process includes completing an online MLab survey, a Qualtrics survey, so that they have information ready to respond when you call to make an appointment. So you complete the survey. The next thing you do is you make a call to MLabs. They have a dedicated line, and you would call and select a time or times. You can select one time, or you can select several times over the term and sort of lock in those appointments. They also are asking that you set up an account through Michigan Medicine portal so that you can receive those results through the Michigan Medicine system. Positive results will be provided by MLabs, and they'll call the individual. If you have a positive result, they'll call you immediately. Negative results will be provided by MLabs through email and or through the account that you've set up through their portal. Now, I provided a couple links here on this particular screen here so that you can see, for those of you who won't be coming to campus for tests, there are other testing options. And those are, if you want to go to the Genesee County Health Department, they have an ongoing list of local sites across the county. But if you're living in another county, Oakland, Macomb, Livingston, Washtenaw, and you're coming to school or working here, there are other test locations that are available. And so going to the State of Michigan COVID Test Finder, you can go there, put in your zip code, and you can find the most current or whatever the current listing of available test sites are near you. Next slide, please. Why don't we go ahead and talk a little bit about vaccination? I know it's been on everyone's mind. It's been certainly a really important topic. And I must say, it really is a game changer for where we are in the pandemic. And having two viable vaccinations or vaccines available to the country is just really great as far as being encouraging and hopeful for seeing sort of the light in the end of the pandemic tunnel. So with that, the COVID vaccination distribution has been underway. It started before the holiday break. Michigan Medicine and other health care organizations, they've been vaccinating individuals, including our U of M employees and students since this started. They're following the recommended prioritization guidelines from CDC and from the state MDHHS. The thing to really keep in mind is these supplies are limited. And although we just heard recently that the state is opening up and expanding what priority group will be able to go and get that vaccine, still the vaccine supplies are limited. And so I think we all just need to make sure we're managing our expectations and know that it could be a little while. Individuals in the 1A group, the healthcare, long-term care facilities, they're certainly in the front of the line, and others are soon thereafter. As far as the process, all U of M Flint faculty and staff will have and actually do have an opportunity to receive the vaccine. They'll have that at some point. I put a link there to encourage individuals to go back and check that link, the umhealth.org. It's their vaccination site, and you can check updates of what prioritization group that the university is in. It's really important to know that the university, the unit at the University of Michigan Enterprise, Michigan Medicine, is really overseeing the implementation and distribution of the vaccine across all entities of the university, and that's faculty, staff, and students. So staying up to date, checking that website is really important. The three things that you will need to keep in mind is if you are interested and you want to get the vaccine through Michigan Medicine, you have to complete the Blue Q questionnaire. Now, many of you have, and I would recommend resubmit it. Probably 1,600 individuals that have completed it. I would say go ahead and resubmit it. They've updated and have improved the communication back to those who are submitting and completing that, so that you get a confirmation email to ensure that they've received your information. So if you want to go ahead and do that, and it's important to know that if you want to receive this vaccination through Michigan Medicine, you have to complete that Blue Q questionnaire. The second thing is it's important to establish the medical record number, and you can get direction on how to do that through that website. And then also creating a My U of M health account through Michigan Medicine. Again, doing those things will help expedite and queue up when they're ready to schedule that appointment and invite you for that vaccine. It's important to note that the vaccine is available through lots of different entities, whether it's the county health department, maybe current employer, if you're working at have a couple different employees, and also through Michigan Medicine. So university is encouraging wherever you can get that, however you can get that vaccine, to go ahead and get that. Whether you've, you complete the Blue Q questionnaire and then you're offered that vaccine by some other means, just get it as quickly as you can. We encourage that. And then it's also important to note that employees should work with their supervisors, and supervisors are encouraged to accommodate getting the vaccine if it's available during their work hours. But know that the vaccine is being made available on Saturdays and Sundays in some communities. So just want to make sure that's clear. So again, supplies are limited, demand is high, be patient. If you can get the vaccine from, someplace other than Michigan Medicine, I'd strongly urge that, but also really strongly urge that you complete that Blue Q questionnaire again, even if you've submitted it, just to make sure they have that information.
Thanks, Mike. We do have a couple of questions. An anonymous attendee asks, if we get the COVID test outside Michigan system and receive negative results, do we report this to anyone? Of course, we will report positive results.
Yeah, the university is asking individuals, when you have even negative results, that's really important to provide that. So if you're an employee, that would go through our Work Connections and OHS, they gather that information. Students, that I believe that could be reported as well. Less of an issue, obviously, like you said, any positive results, let us know as soon as possible.
Great. And then in the next slide, we inserted another question, which we thought you might have. What changes after I get the vaccine?
Yeah, so this has been a topic of lots of discussion. Now I have the vaccine, I don't need to wear a mask or anything like that. And it's really important to note that nothing, changes from a standpoint of the health mitigation measures that we're implementing on campus or in our communities. So there's still an expectation to wear the face covering all the time while you're on campus, complete the Responsible Blue daily health screening, and report if you get a red screen. Quarantine if needed. All of those things are still, you're still expected to follow. If you have symptoms, still are expected to report that. We can talk a little bit about that in a minute, but yes, so we're still following all of those recommendations. And I suspect we'll continue to hear more about this as more and more people are receiving the the vaccination. There'll be more and more questions about when can we start to remove masks. So, but at this time, just hang in there. Let's keep doing what we need to do to keep each other safe. And vaccine is just one of many things that will help our campus, our community, our country get through this.
Great, thank you, Mike. And we do know that many people in our Flint community are getting vaccinated, both through Michigan Medicine and through other hospitals that are in that 1A and 1B, and possibly the over 65 group beginning shortly. So we wanted to ask one of our members of our community, Professor Megan Kaiser from the School of Nursing, who has received both parts of the vaccination, to share her experience and expert opinion. So Megan, if you're able to come on screen, we welcome your thoughts.
Yeah, hi everyone. So I was asked to kind of talk very briefly about, dispel a couple of myths about the vaccine and talk about my experience. Why did they ask me? Because I'm both a frontline worker as well as a school of nursing faculty who's taught pathophysiology and has given many lectures on immunology, inflammatory responses, infectious disease, etc. And as a frontline worker, I was in one of the very first groups in Michigan to receive the invitation to come and get my vaccine from the employer where I'm a frontline worker. I got my second vaccine last Wednesday. It's important to note that all of the myths that are floating around about the COVID vaccine for the most part are untrue. Essentially what you're being injected with is a vaccine that provides instructions or a message to your body to make a harmless piece of protein. Looks like a spike protein. And if you've ever seen a picture under a microscope of the COVID virus, it has all these little spiky proteins on it. And so you're going to be injected with instructions for your body to produce that protein. Once your body produces the protein, it recognizes it as foreign and it attacks it and creates antibodies against it. So that happens when you get the first shot. So why do we need a second shot? Well, because all of the science and studies have said that a second shot makes the vaccine overall more effective. So the first shot, when I received it, it basically a little bit of arm pain, similar to a tetanus shot, but it didn't last nearly as long. It was gone in less than 24 hours. The second shot, which I got last Wednesday, which was 3 weeks after the first, that one, I had the same injection site reaction. I thought I was absolutely fine, and I really was. But a couple of days later, I started feeling a little bit funky. And that made me happy, even though I didn't feel great, just a little bit fatigued, a little achy, because that told me that my body was doing exactly what it was supposed to do, mounting a response against that spiked protein that I was injected with a second time. That is all of which to say that once it attacks the spike protein that's found on the surface of the COVID-19 or coronavirus, it will attack the coronavirus and any form of the coronavirus that also carries that same spiked protein, included the COVID-19 virus. So as everybody has already told you, I keep wearing my mask when I'm out and about, when I'm in the hospital taking care of patients. I continue to socially distance. Just because you have the vaccine doesn't mean you can't carry the virus. There's ongoing scientific studies right now to detect the presence of antibodies in the nose and throat of people who have been vaccinated, because that is where this virus lives. That is how you can communicate it to other people. So I'm sure we'll be hearing a lot more about that, but until we do, essentially, it doesn't matter if I've gotten both vaccines. I'm changing exactly nothing about what I do to protect myself and those around me.
Thank you so much, Megan. I appreciate you coming on. We have a couple of questions about testing. So Mike Lane, if you could come back on before we move on to our next slide. A person asks, if I am positive, do I have to wait for a negative result or just quarantine? And so this is a good segue into our next slide regarding reporting. But if you want to answer that specifically first.
So the question is, if someone's positive, do they wait until what? Until they
get a negative test or just quarantine?
Right. If someone is reported and they're confirmed positive from the test, if it's from our test, we'll know that. But if it's from some other test outside of our testing event, number one thing is first make sure you're reporting that test result for two reasons. One, want to make sure you're staying home. Two, that you're getting the support services that you need, whether you're an employee, a student, faculty member, whatever. As far as a negative test, so things have changed since March. You know, early March of last year, the move was to suggest that you would be isolated, and then you would go back and get a test, and you wouldn't be allowed to return until you had a negative test. That has changed. So really the return would be when someone has tested positive, they're out for 10 days. It could be longer depending on how they're weathering the illness. But as long as they're without fever for 24 hours, their symptoms have improved or gone away, then they are on track for returning on day 10 or thereabouts. So each case is a little bit different, and we vet each one individually, but 10 days is generally what the CDC guidelines is. If someone is immune compromised, then there could be an extension of that. If someone had spent some time in the hospital, that time could be extended as well, because it could take longer for the individual to be in a position where they're not shedding the virus. So it's kind of a long-winded answer, but know that we will vet each and every case individually. And then it's not necessarily that we're looking for a negative test. In fact, it is important to note that if you have tested positive, it's a good chance that you could test positive for up to 90 days after that initial test. And so it really would not be helpful if you're not showing signs or symptoms, and you're cleared to be at work or at class, but you have a positive test 30 days out. So yeah, that shows you just over what we've learned in less than a year. So
Yeah.
going to what Megan said, Megan, that was really helpful. And there'll just be more and more information as more people get vaccinated. And again, testing is increasing. So we're learning more as well about that.
Thanks. We do have a question that may have been covered, but can you talk about what you know about if the Michigan medicine vaccine will be available on the Flint campus?
Yeah, that's a great question. So right now, if you were to log in and you've registered, and then you've been invited back to schedule a time to get vaccinated, you have a couple options through Michigan Medicine. There's a couple in Ann Arbor and then the Brighton location. There are discussions right now, like this week, we've been talking through what this could look like for the regional campuses and how valuable that would be for the regional campuses to be added to those locations. So we hope that comes soon. And we're doing everything we can to partner with Michigan Medicine and their vaccination team to make that happen. So yeah, I think that'll happen. We just
another theme we're seeing, right, Mike? Quickly changing information and fast moving progress in this space. So thanks for that. Let's go ahead and talk about COVID-19 illness reporting for employees and for students. So Mike, you start with the employees.
Yeah, thanks. So we're continuing with the same approach for reporting. So the same thing we did in the fall, it worked out really well. Internally, our case management, case investigation group, we've made some adjustments to improve and streamline, but I think that the process still remains the same, but it's worth talking through this and making sure that everyone's really clear. So if you're feeling ill, so it's not even that you have a COVID positive result, but if you're feeling ill, we want you to stay home, self-isolate, seek advice from your physician and direction from the university. And so connecting up with the university, make sure your supervisor is notified immediately so they're aware and they can make adjustments in whatever schedule. For employees, we want individuals to call OHS, which is our Occupational Health Services at the University of Michigan. It's a component of Michigan Medicine. They have taken on the work of assisting employees walking through and navigating some of the medical portions with our Work Connections our Work Connections partners. And so calling them, letting them know what your symptoms are, and keeping them apprised of that. In addition to that, we ask individuals to notify Human Resources and Environmental Health and Safety. And that can be done by emailing the UMF covid-employee-reporting. I know it's really long, but that email. So it's on our website, it's on the slides, it's in a lot of our materials. But when you email that email, then you will be communicating to a couple people in EHS and HR and making sure that we're well aware and we can get back with you rather quickly to follow up with whether it's symptoms or whatever the question is. Also, there is an online form that we're asking individuals, whether you're an employee or a student, to complete. And that form for employees as well as students, but for employees is located at the www.umflint.edu/COVID-19. That's the page. That's the main page. You can easily get to it from the university's main page by scrolling all the way down to the bottom. So after that, once you've notified, you've shared the information of what your symptoms are, or the status of whether you're positive or what the cases is, OHS will help monitor with Work Connections and with University of Michigan-Flint HR and EHS and determine perhaps if additional testing might be needed or not. And as part of that, we'll be looking at what kind of medical documentation may be required for the return. Again, going to one of the earlier questions where we vet every single case very closely and carefully, that medical documentation is a really important piece of us reviewing that. Some cases are pretty complex. There might be multiple people in a household or an apartment, and we have to take that into consideration where individuals are within, as far as their exposure before we just say 10 days and you're good to come back. So we need to know a little bit more than that. And so before returning, if you're working with OHS, you may actually receive a letter or documentation saying you can return after 10 days. That is just a piece of it. You need to make sure that, in fact, you get a letter from our HR or a communication from our HR department. So again, EHS working very closely with HR to vet each of these. Once we feel comfortable, we vetted the case and seems good for the person to return to work, then you'll get a letter from our HR department. Want to take this time to just remind people that if an employee comes to you and you're the supervisor, yes, encourage them to follow these steps, but also we're asking supervisors to please report that case as well. And that can be done in the same ways as mentioned above, notifying HR and EHS.
Thanks, Mike. We have a question about student employees that Beth answered in the Q&A, but I'm not sure if all of our audience can see everything that comes up in the Q&A. So I'm going to go ahead and ask it, and Beth, you can come on and answer it. Are student employees expected to complete both the employee and the student reporting forms?
So great question. And the answer is that we would love for the student employee to go ahead and complete both forms, but it is not necessary, but they do need to complete the student form. So if you are a student employee and you complete the student side, the student form of the illness and reporting form, then EHS, HR, and student affairs will work together to make sure that we're coordinating the employee side.
Great.
Yep.
Thank you, Beth.
Thanks.
Now I'd like to bring Associate Vice Chancellor Julie Snyder and Dean of Students on to discuss reporting student illness and our process on our campus for case management. Julie?
Great, thank you, Shelby. It's a great segue from Beth indicating that student employees should complete the COVID-19 illness reporting form for students. We are asking all students on campus and off campus, if you become ill, test positive for COVID-19 or are exposed or receive a red screen, to please complete the illness reporting form. If you are a faculty or staff member and become aware of a student who may have been exposed, tested positive, is feeling ill, or received a red screen, please complete the form for the student. Even if you instruct the student to complete the form themselves, we're asking if you could please do it as well, because sometimes there's a delay in that communication, and it is important for us to be able to respond to those reports as quickly as possible. Again, if you are completely remote and haven't been on campus all fall semester, we are still asking you to submit that information because that allows the university to assign you a case manager whose responsibility is to reach out and provide you support as you work through the illness. In order to return to campus, the case manager will walk you through the series of steps that would include documentation to be cleared to return to campus. Even if you are remote, you still need to be cleared to return to campus in case you needed to visit the library or another facility on campus. So even if your courses aren't on campus, you still need to complete the return to campus process. And so the biggest message I think that we want to make sure that people understand as we head into the winter term is to please report student illness as quickly as possible. And if we could go ahead and advance the slide. And so the case management process from the student perspective, when we receive a report, a case manager is assigned, and those case managers are 6 students from the Department of Public Health under the direction of Professor Michelle Salih. This program was developed this summer when Public Health reached out to ask how they could provide us support as a university. And the case managers work with all of our students to understand what aspect of COVID-19 they are dealing with, what their needs are, and how we can support them through the process and back to campus. Words can't even really put into description what these 6 students and Michelle did for the university. We received over 500 reports for the fall semester, and the work that they did has been tremendous. They were diligent in supporting students who are managing various aspects of the virus. Their work was tremendous, and they were often responding within minutes of us receiving a new report. They often worked late nights or early mornings or even on the weekends to respond to reports. And their dedication is really a profound reflection of their empathy, both as professionals going into public health, but just as human beings and members of our community. And so I believe U of M Flint is really indebted to these students and to Michelle and public health. And I believe they are a real proud demonstration of what it means to be the leaders and the best. And so we didn't want today to go by without acknowledging the work that they did in the fall semester. And a new group of students are currently being trained to continue that work for the winter. And now I'll turn it back to Mike to talk about faculty staff case management.
Before jumping to that, I have to second everything that Julie has just said about those case managers and Michelle. It has been, you're going to want to go back one slide. Sorry, Nick. Yeah. But it has made all the difference having Michelle lead that group of students, professional students through this process. It was, at times it was very, I don't want to say overwhelming, but it was a lot of work for that group. And again, working in the evenings, weekends, throughout the entire fall term. It was quite an effort. Moving on to the faculty and staff case management. So HR and EHS are really coordinating the case investigation, contacting employees, monitoring any of the cases that are reported. And these cases could be anything from just having symptoms or a family member that has tested positive or some sort of exposure. It's anything and everything. And for a long time, we were saying each case seemed like a very unique case. It's like, oh, here's a new case. And that was the case, I think, whether it's in the student case management or in the, we saw with the employee side. With that, similar dedication we see with staff that are reaching out in evenings and weekends and following up with employees and making sure they have the resources and just checking in on those employees to see how they're doing. EHS has been coordinating with the Genesee County Health Department. And so as cases come up for the positive cases, we work closely with Genesee County Health Department. We talk, and we more or less help kickstart the contact tracing so that they can pick up and carry it forward. As the fall moved forward from, into November, December, we saw that the Genesee County Health Department was really leaning a little more on our campus to do additional contact tracing. And that effort was picked up by our team. HR and EHS, we coordinate closely with our colleagues in Ann Arbor and Work Connections and our occupational health services. As mentioned previously, employees are calling into OHS and getting medical advice and reviewing test data with them. And then again, EHS and HR are working closely and vetting through that information to determine the best, first of all, what kind of resources and support that individual needs, why they're off campus or working from home, as well as any other needs that we might not be thinking about or initially. As far as the critical piece that I mentioned earlier, although OHS has a process where they'll send out a communication to the employee saying you should be good to return on and such a date. HR and EHS, we make sure we're vetting and contacting that employee a day before that time frame is up, so that we're making sure that the person is either no longer has symptoms, that they've improved, they're feeling better before we allow them to return. So again, really important that that both supervisors and employees understand that process, not to come back to campus until they receive the clearance from HR. As far as the number of cases, we did see over 100 submittals through the employee side. Again, pretty large, going through and talking with all these individuals and helping them. I think the positive thing here is that probably everyone on this call has received some emails indicating that a positive case or a couple positive cases have been identified. And I think, the total number that Mike Hagan mentioned, 54, we're posting that on the website, and all those communications are posted. That number is reflective of the individuals that have been on our campus that had tested positive, but they've been on our campus while they may have been infectious. It does not include people that are living in other counties or outside, or they were never on our campus. We just felt that really the important communication here is what really impacts people coming onto the campus. So just want to make sure that's really clear for individuals.
Thanks, Mike. We have a question about positive cases, if you can take that now.
Sure.
And I'm not sure if you can answer it, but let's give it a shot. How many of the positive cases were from construction workers versus student, faculty, and staff?
Yeah, so don't hold me to the exact number, but it's somewhere maybe 8 to 10.
Construction workers.
Yeah.
So we are committed to reporting any on-campus cases, and so that's why people are seeing non-UM
right.
employees being reported in the same number.
Yeah, and that's a really good point. So in that 54, you're seeing numbers of non-U of M members that are on our campus. They might work in areas that aren't even university. Maybe they're working in the pavilion, but not with as a university employee. Yes, that's a really good point. And we are committed. We have an arrangement with the county to make sure they have a very clear understanding of the cases. So we report those as well as part of the contact tracing.
Great. And then a question for Julie before we move on to wellness. Are out-of-state or international students required to quarantine when first arriving to campus if they're living in housing?
That depends, and it's all going to depend about if they've been tested and the proximity within that test result based on travel and where they're coming from.
And so they should communicate directly with you.
That's the easiest way to solve the problem.
Yeah.
Great, thank you. All right, let's go ahead and move on to some wellness conversations for the rest of the semester, and then we'll wrap up with some academic questions that are in the chat as we look towards spring and summer. So Beth?
So I wanted to just mention, with our returning to work and doing different things on campus and just in general, right? Employee wellness is important for our overall health and our work productivity. So our faculty and staff counseling and consultation office, FASCO for short, continues to provide virtual sessions for all our faculty and staff. The topics are wide, and on this slide you can see their mental health care, their self care during times of transition, working in home from home strategies, including working from home with children, dealing with uncertain times, fostering personal awareness and resilience during a pandemic, and grief discussion types of groups. So there's several groups that do come up, and again, these are free for our faculty and staff, and these are running January through March. You can find the information, faculty and staff can find that information quickly on the email that I sent out this morning, or from the link that Nick provided in the chat. And then for specific information, check our website and continue to check with FASCO. So these are really good, and the registration is limited. So you do want to get into these seats pretty quickly. It will be recycled and is recycled through the year, and different topics come up. And if you have suggestions on topics, you can send them to FASCO as well. On the next slide, what we talk about is some additional spaces and areas where you can have additional types of wellness, which is our healthy group. So the Active You is open. So it's running virtual, but it's open on January 25th. So watch for that email to come out soon. There's Healthy Portals, which are new suites to provide some information on health and well-being programs. There's a virtual cooking class that keeps recycling through. And then they have some good information about the body, mind, and mood support. So we've included this link on the site. And again, I think Nick has sent that out in the chat. But look for emails from Healthy directly, and then also from Sherry Berry, who's our wellness coordinator. Now, in addition to all of that, there's various activities, workshops, programs, support groups that come up throughout our campus. So just a few of these, and this is not limited to all that are there. So if I've left somebody out, I apologize, but these are ones that I just wanted to mention. And of course, take a look through any of the happenings groups and any other email groups. But there's the mentoring group sessions that pop up for support groups, Wind Down Wednesdays that you'll see, TCLT, DE&I and Organizational Learning, Intercultural Center, Center for Gender and Sexuality. All these areas, addition to more, have programs that they have out there. I also want to point out that the Recreation Center is open to faculty and staff who have memberships. And then, of course, to our students who are part of the membership program. So check out all these things in ways that you can help, keep yourself healthy in these weird times, right? And as we dial up and come back to campus and not do that quick flip switch, we all need to be ready for that too. So being healthy and productive, all of this goes together. Can't stress that enough.
Thank you, Beth. And now, Julie, can you come on and give us a student life update?
Absolutely. We're excited for the winter semester for our students. Into late in the fall semester, we were able to roll out our equipment loan program for students. This is for individuals who may need assistance with laptops or hotspots. And we are really excited that we are able to provide this. So if you are struggling with remote work, we encourage you to apply for support through the equipment loan program, and the link has been dropped into the chat and will be available. This semester, things will remain pretty much the same as it relates to student life. We encourage students to attend the engagement fair on January 21st from 5 p.m. to 7 p.m. on the Engage platform. This is an opportunity to interact with other students and get involved in our student organizations. And we've seen a lot of creative talents being used in the fall semester to keep students connected to one-on-one. All of our support services are still available for students in the winter semester. Our counseling and psychological services appointments are being done virtually, and you can schedule those by reaching out to CAPS via phone. If you need to get registered with Disability and Accessibility Student Services, please reach out via email. All of the enrollment management functions, from financial aid to the registrar to the Student Success Center, academic advising, the writing center, the library, want to make sure that students understand that these are all still available for you, and please to take advantage of your resources to help you be successful. Unfortunately, in the winter term, our plan for campus events remains similar in that there are no campus events and things are being done virtually, no student organization sponsored events, but continue to keep an eye on the Maize and Blue Hub for updates about opportunities to get involved with one another. The Recreation Center remains open and those hours are posted, and so please visit the Recreation Center. And this semester, we're excited to announce that in support of the Wellness Days in February and March, we'll be doing wellness programming around those periods of time to really help students manage all aspects of their wellness and well-being during this ongoing stressful pandemic. And that's all I have, Shelby.
Thank you, Julie. So we continue to have discussions within our reopening committee and at the cabinet level regarding how best to celebrate our graduates from 3 terms, winter 20, fall 21, and fall 20 and winter 21. And whatever we do end up doing will likely look different than past commencements, but I have no doubt that we'll come up with a creative solution to keep our community safe and to give our graduates the celebration that they deserve. So stay tuned for more information on that. It's hard to think forward to spring and summer terms with snow on the ground, but we are hopeful that as we move into spring, we're going to be able to slowly dial up our campus activities and academics. And the academics will continue to have relatively low density on campus, but our spring and summer terms have always had low density even before COVID. So this will allow us to potentially bring back other groups of people to campus, such as orientation and campus tours for prospective students. But these details have not been fully determined yet, so stick with us on that as we continue to figure out what this dial looks like. Julie, can you add any additional thoughts about spring and summer student activities? And then we'll get to a few of these questions.
As we look forward, a lot is still to be determined, including if we'll be able to provide in-person on-campus orientation programming. But we do know that we will be able to provide housing for both spring and summer terms, and those contracts will open later in January. On-campus student organization events, again, are still undetermined, and our hope is to be able to do things as soon as it is safe for our campus community.
Great, thank you. All right, we've got a few questions in the chat, and so just bear with us. We may go over the 4 o'clock mark just a little bit. We want to make sure we get people's questions answered. So regarding the density charts that I showed in the academic slide, this slide deck will be made available in a PDF format as well as the recording on our COVID-19 website in the coming days. But if you would like to see one of those density charts specifically, feel free to email me directly and I can get that to you. A question for Mike Lane: are construction workers required to wear masks properly?
Yes.
Good answer.
Absolutely. Yes, they are. And certainly if you see someone that isn't, you can contact our office or contact facilities, and we'll circle back and track down the construction superintendent and follow up on that.
There is a form on the COVID-19 website that you can report incorrect mask usage, correct?
Yes, there is. Yep.
Great. Beth, a question for you. Thoughts on staff getting a wellness day without having to use vacation time?
Well, that's something that I can bring up as a suggestion to leadership, but at this time, I don't have an answer for the group. But it's a great idea, and I will ask it of higher authority.
Great. There is a question about the DEEP program, which applies to other early college courses. Those faculty members and the departments that offer those classes made the decision to offer asynchronous online courses to accommodate the very complicated high school schedules that were coming out. And so there is no change for winter. Those are still going to be offered in that format. But we look forward to the future when we're able to return to those campuses. Let's see, I've got a couple of questions regarding financial support. Will there be any financial COVID-19 support for students and faculty? And we've worked through CARES Act funding in the first term, and there may be a second round of that funding that's yet to be determined. Beth, do you have anything else to add to that?
Oh, sorry, I'm trying to get my operations to work here. For funding for COVID, if individuals are talking about COVID pay, like if they're out sick for COVID pay, we do have COVID time. That is the bank, the original bank that was available last year is still available if they haven't used that yet for anybody who hired in prior to June 7th of 2020. So if there's questions about using that bank of time, please contact our office. We'll be happy to work through that part of it. And Shelby, I wanted to circle back on the Wellness Day piece because I also want to point out the Wellness Day things, the wellness pieces that we're talking about that I was talking about from employee wellness, like FASCO and M Healthy and those things. Those are sessions that supervisors should be highly encouraged to allow staff to attend during their normal working hours, right? So they're not having to take time away to attend those things that FASCO and Healthy, those places offer, right? So they don't lose pay on that. For a specific wellness day is something I'll have to talk up, to see if there's a possibility that way. So I just wanted to make that clear because I think somebody had another question about FASCO and those things. Did they need to take vacation time in order to attend FASCO or M Healthy days? And the answer is no, they do not have to do that to attend those kinds of sessions during their normal work hours. They wouldn't lose pay for doing that.
Great, thank you. And regarding financial support for students, as I mentioned, the CARES Act funding was distributed in a variety of ways for students and actually for faculty as well, and departments. And so that was distributed in the fall and completely exhausted, but there may be a second round of funding and we'll be sure to communicate that as well. Those funds were used for computer equipment and a variety of like medical and tuition support and a variety of things for students in the fall. And a question of, will the online course fee be waived for winter? And actually the answer is that the online course fee that was associated with specific online class has been removed since May 2020. And so at this point, that's the operations we're in. Those online classes do not have an additional fee associated with them. So I think that's it in our questions. As the slide indicates, conversations continue and it does not end here. So we'll try to keep you up to date as much as possible as our conversation moves to what our dialed up approach looks like over the next year. The reopening committee meets twice a week to review and discuss a variety of items. So bring us your thoughts and your questions as they come up for you throughout the semester. You can email me directly. You can email any of the panelists directly. There's also an info, a contact us section of the COVID-19 website that will get your question answered. We'll have this slide deck and the recording of the session available on the COVID-19 site, so you can check back with that. We hope that you stay safe and healthy. Thank you so much for being a part of our Flint family. We're glad you're with us and we'll see you around. Thanks for joining.